everyone, and welcome to our channel. I'm Dr. Mangs, a gynecologist specializing in the treatment of endometriosis and other gynecological conditions. Today we're diving into a topic that often gets confused with endometriosis but is distinct in its own right: adenomyosis. Adenomyosis is a condition where the inner lining of the uterus, known as the endometrium, breaks through the muscle wall of the uterus called the myometrium. This can lead to the uterus to enlarge in size and cause painful, heavy periods. While adenomyosis can occur in any woman, it can occur at any age, but is progressive, so it's much more aggressive after the age of 25, all the way up to menopause, and it may even continue after menopause. So what exactly causes adenomyosis? The precise cause is still unknown, but there are several theories. Some researchers believe that it could be due to invasive growth of the endometrial cells from the uterine lining into the myometrium above. Others suggest that it could result from stem cells in the myometrium developing into endometriosis cells within the uterine wall. There's also a theory that uterine inflammation related to childbirth could cause a break in the normal boundary of the cells, and the continuity is disrupted, which lines the uterus, and there is invasion of the endometrium into the myometrial junction. Now let's talk about symptoms. The most common symptoms of adenomyosis include heavy menstrual bleeding. Women with adenomyosis often experience prolonged or heavy menstrual periods. A key point of this is that the period is very often preceded by a brown discharge, which is old blood that is collected inside the uterus and is passed painfully at the onset of the menstrual cycle. Severe menstrual cramps. These cramps can be debilitating and more intense than typical menstrual cramps. Chronic pelvic pain can occur outside of the menstrual cycle and may be constant. Pain during intercourse. Many women with adenomyosis report pain during sexual activity. An enlarged uterus. In some cases, the uterus may be tender or feel larger than usual during a pelvic exam. In some cases, it may be so big that it may be palpable as an abdominal mass and may resemble a mild pregnancy. Diagnosing adenomyosis can be tricky. Often, it's confused with other conditions like fibroids or endometriosis because of the overlapping symptoms. The diagnostic process typically involves a detailed medical history, a pelvic examination, and imaging tests such as ultrasound or MRI. Occasionally, a biopsy may be performed, but it's not always conclusive for adenomyosis. So diagnosing adenomyosis is usually made by specialists very easily. For example, if we're doing a transvaginal ultrasound, the first thing we look at is the volume of the uterus. Anything over 80 cubic centimeters is considered enlarged. Secondly, we look at the texture of the wall of the uterus, and when we see heterogeneity, which means irregularities between the bright and the dark areas, that is highly suggestive of adenomyosis. Also, adenomyosis can be very irregular, and when it blocks the ultrasound beam coming through, it can appear as a fan-shaped appearance. Since adenomyosis is also very often accompanied by endometriosis, we may see some severe adhesions related to endometriosis or lesions of the disease itself. So how do we treat adenomyosis? Treatment options can vary depending on the severity of your symptoms and whether or not you wish to preserve fertility. Here are the few approaches. Medications. Anti-inflammatory drugs like ibuprofen can help manage pain. Hormonal treatments like birth control or Dynogest, or intrauterine devices like the Mirena can help reduce heavy bleeding and pain. Non-steroidal anti-inflammatory drugs, also known as NSAIDs, these are commonly used over-the-counter medications to help reduce pain and inflammation. Hormone therapies can help control the growth of the adenomyosis tissue and reduce symptoms related to the disease. Surgical options. In severe cases, surgery might be necessary. A hysterectomy, which is removal of the uterus, is considered a definitive cure for adenomyosis. However, it is usually a last resort, especially for women who wish to maintain fertility. A conservative option may be an adenomyomectomy, which is excision of the disease from the uterine wall with reconstruction of the uterus. This is a far more complex surgical procedure than a hysterectomy, and in these cases, the surgeon's skill, experience, and patient selection is key. Minimally invasive procedures like endometrial ablation or uterine artery embolization can be effective in some cases to reduce adenomyosis-related pain. While medication and surgery are primary treatments, lifestyle adjustments can also help manage symptoms. For example, maintaining a healthy weight, engaging in regular physical activity, and following an anti-inflammatory diet rich in fruits, vegetables, and omega-3 fatty acids can help alleviate symptoms. Some women find relief through alternative therapies such as acupuncture, physical therapy, and mindfulness techniques. While these should not replace conventional treatments, they can complement them. Living with adenomyosis can be challenging, but there are effective treatments available. If you suspect you have adenomyosis or are struggling with symptoms, it's crucial to speak with a healthcare provider who can guide you through the diagnostic process and help you find the best treatment plan. Thank you for watching. If you found this video helpful, please give it a thumbs up and don't forget to subscribe to our channel for more information on women's health. Feel free to leave any questions or topics you'd like us to cover in the comments below. And remember, taking care of your health is the first step towards a better quality of life. See you next time.